Our new Algorithms for Threat Detection grant is about modeling infectious diseases using models that are called point processes. And common models used during the COVID-19 pandemic, like compartmental models, kind of need a large group of people to be infected, and they're only really applicable when the numbers get really bad. These point processes are more suitable for when you have an emerging epidemic where there's small event counts and there's a lot of randomness involved. And what these models, these point process models that we hope to develop can do is detect emerging epidemics and assess the probability that those will turn into a pandemic. Every day we're discovering new diseases, and there's an email list and a database that's compiled of all these different diseases that people are reporting. And what we would like to know is, what is the risk that this will turn into the next COVID-19 pandemic? Another thing we've seen is, we're not randomly testing, at the levels maybe we could be, or testing everybody for diseases. We're doing contact tracing based on very limited data. And so you have to kind of fill in missing data, who was infecting who in a social network. We might not know that for sure, but these models can try to fill in that missing information to kind of give a better picture of an existing pandemic or assess the risk of future ones. People are using these models to estimate the reproduction number of the virus. So for example, we know that the reproduction number of the Delta variant is much higher than the previous variants we've seen, which is concerning because that means you spread it to more people if you're infected on average. So these models can be used for inferring those sorts of parameters of a pandemic. They will also be able to be used for forecasting. So local governments can make decisions on, when to open or close schools or when to require masks. So these models can be used to inform kind of public health decisions for this pandemic, but also for future ones.